Hello, how are you doing? Good. My name is Lee and I'm the one that's going to be taking care of you today. It looks like they said that you came into the clinic because you feel like you may have like a deviated septum. Alright, well how about this? Let's get a chart opened up for you. I'll gather your history a little bit and then we'll kind of address that further, okay? Alright, so can you give me your first and last name? Date of birth? Looks like there is a chart already for you in the system, so that's great. And can you confirm the insurance that you're currently using? Okay, and then can you confirm your phone number? Okay, and can you confirm the emergency contact on file? Okay, and who is that in relation to you? Okay, what's the area code on that? Perfect, thank you. And then the last thing computer-wise that I'll need is just pharmacy on file. Which one would you prefer? And what city is that in? Okay. Perfect. So you're kind of looking for like a nose examination just to see if you may have a deviated septum. You found it hard to breathe your whole life. Okay, yeah. Interested in a surgery if you're able. Gotcha. Okay, for sure. So yeah, we'll totally get that examination going for you. As far as current medical history, is there anything that I should be aware of? Okay, anything else? Okay, and do you take medications for either of those things? Okay, and how often do you take that? Just as needed. Okay. Any surgeries that you've had before regarding, your face, ears, eyes, nose, throat? And what year was that? Do you remember? Gotcha. One or both sides? Okay. Sounds good. Okay, and do you smoke at all or drink alcohol? And how often? Okay. Any situations with trauma to the nose? Do you remember ever falling on your face or your nose when you were a child? Do you get nosebleeds at all or frequently or? Okay. Gotcha. It is hard to figure out when you have both of those things going on for sure. Yeah. No, I completely understand. Okay. Any congestion? Mucus? Okay. And of course, you haven't put any foreign bodies in your nose, right? Okay. Any history of piercings at all? So nothing's in your nose. Okay. Just gotta check, you never know. All right, so I am going to take your vital signs and then we will get started on the examination of your nose. I'll step out, grab the equipment that I need, and then we'll get everything going for you just to kind of see if there is any sign of deviation, just so hopefully you'll get more answers to the symptoms that you've been having. Oh, not a problem at all. Yep. Let me just put some sanitizer and then we will get your vitals going here. Let me just grab a stethoscope. I'm just gonna grab this. All right, we'll do blood pressure first if that's okay with you. Do you have an arm preference by chance? Good with either one? All right. If you wouldn't mind sliding your arm. Perfect. Does that feel nice and snug? Okay, just making sure. All right, let's see. Okay. Blood pressure is normal. Let me get the extra air taken out of there for you. And if you wouldn't mind just sliding your arm out. Perfect. Very good. Just put this away. We'll document your blood pressure. And then I'm just going to do a temperature check. And then we'll get everything for your nose exam, okay? For sure. Alright, so let me close this up here. Next step is temperature check. Okay. My day is going well. Thank you for asking. It's actually a beautiful day outside today. I went to the park with my son. Something fun that we did together. A little mother-son day. This is going to go under your tongue. But yeah, it's a beautiful day today, so enjoy it when you leave here. Sorry, I like tapping it while it's just passes time. Alright, temperature is normal. Let me just grab an alcohol swab here. Gonna see a lot of these with ear, nose, and throat concerns. Alright, very good. We'll get that thrown out. Gotta keep everything sanitary. Okay, so I am gonna go grab the equipment and then we will get started on your nasal exam to see if there's any deviation whatsoever with regards to your septum. So I am just gonna go let the staff know what I will be doing in here. I'm gonna kind of leave out a tray with all of my supplies. If you want, we could have you lay it on the medical table behind you. Let's actually do that. I feel like it would be more comfortable for you, and then we'll kind of take it from there. For sure. Absolutely. Okay, then I will be back here shortly. Alright, I think I brought everything that I need. Are you comfortable like that? Awesome, awesome, awesome. So, let me just, I'm going to set up my station here. So I'm just going to keep that blue cover over you here, if that's okay. Awesome. So let me put my gloves on. And then we'll probably start just by doing a quick sketch of your nose, taking some measurements, and then we'll take a look inside, okay? Awesome. Okay. So, I am no artist, but let's try our best here, shall we? Okay. Alright. My gloves. Let me just get my supplies set up here. Okay, got this. So I am just going to make some quick measurements along your nose here. Okay. It's kind of like just to get the measurements of my rough sketch here. So sorry if I'm so close to your face right now. I apologize. Okay. beautiful nose, by the way. And I know it's causing you problems, but at least it's pretty. Okay. Take a deep breath in for me. Okay. Take a deep breath out. Flare your nostrils out. Okay. All right. So, I think we have our general sketch of the nose, which is great. Next thing I'm gonna do is I'm gonna take a quick look inside, okay? So, yep, just look up for me. Turbinates look healthy. Just for like initial inspection, of course. Okay. Let's see. Okay, you know what? I am just going to take a little instrument that's going to help me look a little bit further in, okay? So, sorry, this is just going to press on your nose here. Just going to expand your nostrils a little bit there. Okay. So, let's actually go in with an otoscope. This is probably the best way we're going to see everything. Let's put a little cover. Okay. This is going to go just inside of your nose. If you could touch it up. Let's see. Okay. Apologies for the construction going on. Okay. I think I am going to have to use a little bit of a swab here just to clear out the area a little bit. Okay. Let's try this here. Okay. It's not bugging you too much, right? Okay. Yeah. Yeah. Okay. Let me turn that off. Let me just clear you off here. Sorry about that. Sorry. Okay. I don't do a lot of nose inspections, gotta be honest. So I'm still figuring that out. Okay. Next thing, I'm just gonna feel here. Does that hurt at all? Okay. I did see some slight deviation to your left, by the way, when I was in there. Slight left deviation. So I think it would at least be warranted that you see like ENT surgeon, because I do think you'd be a candidate, and I will of course get you that referral for sure. Let's get rid of this here. The other thing that I do need to do is a smell test, just to make sure your sense of smell is intact on both sides, or if maybe one side is stronger than the other. If you wouldn't mind, actually, if you could, plug one nostril, breathe in, breathe out. Okay, same thing, breathe in, breathe out. Okay, let's test sense of smell. I've got my tester kit here. Going to get this going. All right. That went really good job. Okay, let's test. Can you smell this? Yeah, good job. Okay, let's try another one. Let's try another one here. Okay, can you smell this one. Good. We do various scent tests to see like the strength, how low or high can it be for you to be able to smell it. Oh, this one. Good job. Okay, yeah. For sure. So if anything, it's probably like a mild deviation, you know, but definitely still worth a discussion if you feel like it impacts your quality of life. Definitely. Okay, so here's what we're gonna do. Okay, let me take these off. I am gonna write you a script to meet with an ENT surgeon. I do feel like you would make a pretty decent candidate to discuss a septoplasty, okay? Especially, you know, with the symptoms that you've been having. So I am gonna write this over here for you. And the girls are gonna actually give this to you at checkout. I am going to finish up my notes here, but do you have any questions at all before I give you some privacy? It all makes sense? Awesome. Love to hear it. Well, thank you for giving me the time to do your exam. The girls will see you at checkout and they'll give you that script for the consultation, okay? Awesome, awesome. It's a pleasure seeing you. I hope you have a good one.